Here we meet again. Welcome to your masterclass by Medicoapps. I'm Dr. Mohammed Sarosh. We're going to learn very important topic called health planning committees. Okay, I know it's difficult for many of you. Let's make it simple. Ready? First came Bhore, and he formed a health committee and said in 1946, a year before the independence, okay, there needs to be a center where all basic healthcare is available, and that center should be at least catering to 40,000 population, and call that as a primary health center for 40,000 population. And then for long term, he said we need to have a primary health center which should be like having a lot of beds and people having getting admitted in secondary health unit and tertiary health unit like this 650 and 2,500 beds. Remember this one, very important. 40,000 population, one PHC is a recommendation by Sir Joseph Bore. And then we have this concept of social physician brought in by him. And he said at least people, all the medical students after the internship, during the internship, they should actually have 5 months of posting in SPM or the Social and Preventive Medicine Department. In school health also he has contributed, and then comprehensive healthcare concept like the promotive at primary level, the preventive at primary level, and the curative at secondary level was put forth. Then Balwant Roy Mehta committee came in 1957, who said, yes, we need to establish a governance in that should be by people for people. That is Panchayat Raj institutions. And the three-tier rural health infrastructure put in place at the district level. We call it as Zilla Parishad. Zilla is a district, and Parishad is a building with people. And then you have at block level the Panchayat Samiti, with many people sitting together. That is of the many panchayats sitting together. That's Panchayat Samiti. And finally, you have the panchayat at village level, that you see an elder person selected at panchayat delivering and listening to people there. Then we have the Renuka Roy committee in 1961, who said we need to take care of the school health services. Bore also said this, and then forwarded by Renuka Roy. And this provision of school meals, midday meals that we have now, one of the important one which was initiated then. And then medical examination should involve, and parents should be involved there also. Then Mudaliar Health Committee in 1962, he said that we have to continue with that PHC delivering for 40,000 population, and we have to have like IAS, Indian Administrative Service we have. Similarly, we need to have for health also all India health services administration system like that. And to strengthen the district hospitals with specialist service like having eye care and specialty services given there. Chadah workers by Chadah committee. Like in 1963, he suggested that we need to have some like workers also, health workers, create a new cadre of workers also. Okay, that is one basic health worker for 10,000 population is what created by him. Like you can remember like Chadah, Chadi workers or the health workers, not to just be mean, just to remember. And then also this when he was suggesting all this, that was a phase going on for the national malaria eradication program, and that needs to be maintained, so he gave some recommendations there too. Then came Dr. Mukerji committee, that is 1965 to 66. That is, he said we need to separate family planning and the malaria service. All are getting in one place and we're having a difficult time controlling both. So he delinked and said basic health services should be put forth. Jungalwala committee in 1967, he said we need to integrate all the health services, not separate, integrate everything in one umbrella, like okay, and equal pay for equal work, like that. The salary of the doctors were increased during Jungalwala committee. Ban on private practices by the government doctors was put forth. Then came Kartar Singh committee in 1973, and this wonderful person said, yes, we need to have some more hands. For that, we need to recruit some more. Then created the concept of multi-purpose workers and have PSC wider coverage than right now. That is more like 50,000 population should cover now. And we should have one male health supervisor and one female health supervisor who are taking care of the healthcare workers and the population under them. Then Srivastav Committee in 1975, who said we need to also have some band of created for health workers, health assistant like, okay, and also village health guide, and initiated the Rome scheme, reorientation of medical education, having again internship, and everything is given clearly in this. Even the referral service was clearly defined as the primary referral, secondary referral, and tertiary. When to refer like, and also it's also known as medical and educational commission. Important question. The education component is there and the medical component is there. Health workers, isn't it? It's in 1975. Krishnan committee in 1983, he said urban revamping, we need to take care of the urban health. Bajaj, Hamara Bajaj, that's 1986, taking care of education and also about the manpower. So the doctors and the people who are making the doctors, like that. The formulation of national medical and health education policy, and also the national health manpower policy that also was created by him. All right, that's for this session. Thank you for listening. Have a good time. We'll see you in the next session.